Good morning. Knee pain after the age of 60 is not uncommon, but persistent pain is never something to ignore. What many don't realize is that some of the most damaging contributors to this discomfort happen not during the day, but within the first 60 minutes after waking up. Let's look at the top 4 morning mistakes that silently make knee pain worse, and what can be done instead. One of the most overlooked contributors to knee pain after the age of 60 is neglecting joint warm-up first thing in the morning. The way the body functions during sleep is fundamentally different from its daytime state. While resting, circulation slows down, muscles and tendons become less active, and joint lubrication, the synovial fluid that allows the knee to glide smoothly, settles and thickens. Upon waking, many individuals make the mistake of immediately standing up, walking briskly to the bathroom or kitchen, or even heading straight into morning chores without allowing the knees time to ease into movement. This abrupt transition from hours of inactivity to immediate load-bearing is a shock to aging joints and can lead to sudden stiffness, increased joint friction, and, over time, greater inflammation and pain. The knee joint, which is already susceptible to degenerative conditions like osteoarthritis in later life, is particularly vulnerable in the morning. When warm-up exercises are skipped, the muscles surrounding the knee, the quadriceps, hamstrings, and calves, remain tight and less responsive. These muscles help stabilize and support the knee during walking and other daily activities. Without adequate activation, they cannot perform their job effectively, leaving the knee joint to absorb more impact than it should. Additionally, ligaments and tendons that have rested in shortened positions during the night do not stretch easily right after waking, which adds further strain to the joint. A lack of early morning mobility also hinders the reactivation of synovial fluid, which functions like oil in an engine. This fluid requires movement to circulate and become more viscous, thereby cushioning the joint and reducing friction. Without this necessary fluid movement, the joint surfaces rub against each other more harshly, leading to microtraumas that accumulate over time. This results in worsening pain, reduced range of motion, and in some cases, the need for medical intervention. For individuals over 60, the stakes are even higher. Aging naturally brings a decline in cartilage thickness and joint resilience. When morning routines ignore this biological reality, the stress placed on the knees can become chronic. What starts as a few moments of discomfort in the morning may evolve into consistent pain throughout the day. Unfortunately, this pain often leads to avoidance of movement altogether, which creates a cycle. Less movement means stiffer joints lead to more pain, and more pain discourages further activity. The simple act of spending 5 to 10 minutes each morning engaging in gentle joint warm-up, such as leg extensions, slow knee bends, ankle pumps, and light stretching, can dramatically change the trajectory of knee health. These movements stimulate blood flow, loosen surrounding tissues, and prepare the joints for the activities ahead. Although it may feel like a minor change, incorporating a warm-up into the morning routine is a preventative strategy that protects the knees from the cumulative effects of wear and tear. Skipping morning hydration is a common but underestimated mistake that significantly impacts knee health, especially in individuals over the age of 60. After a full night's rest, the body naturally becomes mildly dehydrated. During sleep, no fluids are consumed for approximately 6 to 8 hours, yet the body continues to lose moisture through breathing, perspiration, and metabolic processes. This overnight water loss, although subtle, accumulates and directly affects the joints, particularly the knees, which are already vulnerable to age-related degeneration. The knee joint depends heavily on adequate hydration for optimal function. Within each joint is synovial fluid, a viscous substance that acts as both a lubricant and a shock absorber. This fluid helps minimize the friction between the cartilage surfaces of the bones, allowing smooth and pain-free movement. However, when the body is dehydrated, the production and quality of synovial fluid are compromised. It becomes less effective at its job, resulting in more friction, which wears down the cartilage over time and leads to inflammation and discomfort. This is particularly problematic for aging knees that are already experiencing reduced cartilage density and elasticity. Hydration plays an even deeper role at the cellular level. Water is essential for maintaining the health and flexibility of the cartilage itself. Cartilage is composed largely of water, nearly 70 to 80% in healthy tissue. When the body is low on fluids, the cartilage loses some of its cushioning ability and becomes more brittle and prone to damage. This loss of shock absorption means that everyday activities like walking, climbing stairs, or standing from a seated position can place greater stress on the joints. Over time, This can accelerate degenerative changes and lead to chronic pain conditions such as osteoarthritis. Older adults often experience a reduced sense of thirst, which makes it easier to overlook the need for water, especially first thing in the morning. Some may choose to drink coffee or tea immediately upon waking, not realizing that these beverages, while hydrating to a degree, can also have a mild diuretic effect, potentially contributing to further fluid loss if not balanced with water intake. The result is a compounding cycle. Joints that are already dry upon waking become more stressed as the morning progresses, leading to stiffness, limited mobility, and pain that could otherwise have been mitigated by something as simple as a glass of water. By making morning hydration a consistent habit, individuals over 60 can support not just overall health but specifically the resilience of their knee joints. Water helps rehydrate tissues, reactivates synovial fluid, and prepares the body for movement. This small yet critical step provides the knees with the lubrication they need to handle the day's activities without unnecessary friction. When ignored, the consequences may not be immediate, but they accumulate silently until pain and degeneration become noticeable and harder to reverse. Wearing the wrong footwear indoors is a daily habit that many people over 60 overlook, yet it has a profound impact on knee health. As we age, the structural integrity of our joints begins to decline. The knees, which bear much of the body's weight throughout the day, are especially susceptible to stress caused by improper foot support. While many individuals focus on wearing appropriate shoes when going outside, they often forget that the hours spent inside the home, in slippers, socks, or even barefoot, can silently contribute to knee pain and joint deterioration. Flat, unsupportive indoor footwear fails to provide the necessary alignment and cushioning that aging joints require. The arches of the feet naturally flatten over time, a condition known as fallen arches or adult-acquired flat foot. When there is no arch support, the foot rolls inward excessively, a motion called overpronation. This misalignment travels upward, affecting the knees by altering the angle at which they bend and absorb pressure. As a result, the medial inner side of the knee often bears more load than it should, increasing wear on the cartilage and leading to discomfort, inflammation, and even long-term joint damage. Barefoot walking on hard surfaces such as tile, hardwood, or concrete compounds the issue. Without any cushioning between the sole of the foot and the floor, every step sends a shock wave up the kinetic chain, from the feet to the ankles, knees, hips, and even the lower back. For someone in their 60s or older, whose joints are less resilient and more prone to wear, this repetitive impact becomes a constant source of stress. Over time, this can contribute to not only knee pain but a change in walking mechanics, further stressing ligaments and tendons around the joint. In addition to lack of support, the type of material and shape of indoor footwear also matter. Loose slippers that lack heel stability allow the foot to wobble inside the shoe, reducing balance and increasing the risk of falls. That instability forces the knees to work harder to stabilize the body during simple movements like turning, squatting, or standing up from a chair. Even more concerning, some people opt for slippers with no back or grip, which can lead to uneven steps or quick, jarring movements that place unnecessary torsion on the knees. The solution lies in choosing supportive, cushioned indoor footwear that promotes proper alignment. Shoes designed for indoor use should have arch support, a slight heel lift, firm heel counters, and shock-absorbing soles. These features help distribute body weight evenly, reduce pressure on the knee joint, and encourage healthier walking patterns. Although this may seem like a minor lifestyle change, the long-term benefit for knee health is substantial. Without supportive footwear, the stress placed on the knees becomes cumulative, slowly eroding joint integrity. Making a conscious decision to prioritize proper foot support inside the home can reduce pain, improve posture, and protect the knees from further strain. Ignoring morning swelling or stiffness is a common oversight, particularly among individuals over 60, who often mistake these symptoms as normal signs of aging. However, persistent stiffness or mild joint swelling upon waking is more than just a discomfort. It can be a critical early indicator of underlying joint inflammation or degenerative joint disease. When these signs are dismissed or minimized, the opportunity for early intervention is lost, allowing the condition to progress and increasing the risk of irreversible cartilage damage. The knee is a complex joint made up of bone, cartilage, ligaments, and synovial fluid. With age, all these components become more vulnerable to wear and tear. When stiffness occurs in the morning and lasts for more than a few minutes, it may reflect a buildup of inflammatory byproducts in the joint overnight. During sleep, physical inactivity leads to slower circulation of synovial fluid, which in turn allows inflammatory mediators to accumulate. This results in swelling, pain, and a feeling of tightness when first attempting to move the knee in the morning. If this pattern repeats daily, it should not be ignored. It often points to the early stages of osteoarthritis or inflammatory conditions like rheumatoid arthritis. Failing to respond to this early warning can accelerate joint degeneration. Cartilage, which cushions the bones in the knee, has no blood supply and relies on joint movement to receive nutrients through synovial fluid. When morning stiffness prevents movement and goes unaddressed, this deprives the cartilage of the necessary nourishment, making it more prone to breakdown. As cartilage wears away, bone surfaces begin to rub against each other, leading to increased pain, reduced mobility, and eventually the development of bone spurs and deformity. What may begin as a mild stiffness lasting 15 minutes can evolve into chronic, debilitating pain that interferes with walking, standing, and daily life. Another consequence of ignoring morning symptoms is muscle weakening around the joint. People experiencing knee stiffness may instinctively avoid movement, reduce their activity levels, or modify their gait to compensate for discomfort. While this might offer temporary relief, the long-term result is weakening of the quadriceps and hamstrings, key muscle groups that stabilize the knee. Weakened muscles reduce joint support and increase the mechanical load on already vulnerable structures, further hastening cartilage wear. By paying attention to morning stiffness and swelling, one can take simple steps to reduce inflammation and protect joint health. These include incorporating low-impact movement shortly after waking to stimulate synovial fluid circulation, applying warm compresses to ease joint tightness, and evaluating daily habits that may contribute to inflammation, such as poor diet or lack of hydration. In cases where morning symptoms persist beyond a few weeks, a medical assessment may reveal early arthritis or other joint pathology, allowing for early intervention through therapy, exercise, or medication. Early recognition and appropriate response to these signs can significantly delay the progression of joint disease and preserve mobility and quality of life. Doing high-impact morning exercises is a well-intended but often misguided approach to health, particularly for individuals over the age of 60. While staying active is essential for joint health and overall well-being, the type and timing of exercise matter greatly. High-impact activities such as jumping jacks, stair sprints, or sudden bursts of running are particularly risky when performed early in the morning, especially without proper warm-up. These exercises place significant stress on the knee joints, which are already more vulnerable due to age-related wear and tear. Instead of promoting joint health, these routines can exacerbate existing conditions like osteoarthritis and lead to increased pain, inflammation, and long-term joint damage. During sleep, the body enters a state of rest where joint fluid becomes less active, muscles relax, and circulation slows down. Upon waking, joints are not yet fully lubricated or warmed up for high-stress movement. Introducing abrupt, forceful exercises at this time places the knee under undue pressure. The cartilage, which provides cushioning between bones, becomes less resilient with age and more susceptible to microtears and erosion when subjected to sudden high loads. The ligaments and tendons supporting the knee are also less elastic in the morning and more prone to strain when overstressed. As a result, high-impact movements can trigger inflammation in the synovial membrane and aggravate already irritated tissues. For those with early signs of arthritis or chronic knee pain, the effects are even more pronounced. The repetitive pounding of high-impact movements can increase joint inflammation and accelerate cartilage breakdown. Morning is when joints are at their stiffest and least prepared to absorb shock, and loading them with activities that require rapid force absorption leads to a higher risk of flare-ups. It may not always result in immediate injury, but the cumulative impact over weeks and months can worsen existing conditions and lead to a noticeable decline in knee function. Additionally, high-impact morning workouts often involve quick changes in direction, jumps, or sudden stopping and starting. These movements require strong neuromuscular coordination, which tends to decline with age and is particularly limited first thing in the morning. A misstep during a jump or a twist while climbing stairs can easily result in a ligament strain, meniscus tear, or other acute knee injuries that may require extended recovery time. Low-impact alternatives such as walking, cycling on a stationary bike, swimming, or controlled stretching provide much safer and more beneficial options, particularly in the early hours of the day. These activities help activate synovial fluid, enhance circulation, and gently engage the muscles around the knee without overwhelming the joint structure. The key is to recognize that movement is vital, but so is protecting the integrity of the joint by respecting its limitations, especially during the vulnerable early hours after waking. Thoughtfully choosing exercises that support rather than stress the knees can significantly improve joint longevity and daily comfort for individuals navigating the physical changes that come with aging. Avoiding movement altogether, especially after waking up, is a significant mistake that can worsen knee pain and stiffness in individuals over 60. While it might seem intuitive to rest the knees to prevent pain, prolonged inactivity has the opposite effect on joint health. The knee joint relies heavily on regular motion to maintain proper function, and when movement is avoided, the natural processes that keep the joint lubricated and flexible are disrupted. This leads to prolonged stiffness, increased discomfort, and a higher risk of developing chronic joint problems. The knee joint is surrounded by synovial fluid, a vital lubricant that reduces friction between the cartilage-covered surfaces of the bones. This fluid is not static. It circulates and replenishes primarily through movement. When a person remains sedentary or avoids moving the knees for extended periods, the synovial fluid thickens and becomes less effective at cushioning the joint. This lack of lubrication causes the cartilage to dry out and wear down faster, increasing the chances of pain and inflammation. Essentially, the joint becomes rusty without regular motion, leading to morning stiffness that lasts longer and is harder to overcome. Moreover, remaining immobile reduces blood flow to the knee area. Blood delivers essential nutrients and oxygen necessary for cartilage health and repair. Without sufficient circulation, the tissues around the joint do not receive the nourishment they need, impairing the body's ability to heal minor damage and maintain joint integrity. Over time, this can contribute to degenerative changes such as osteoarthritis, characterized by cartilage breakdown and bone spur formation. Muscle weakness is another consequence of avoiding movement. The muscles around the knee, including the quadriceps, hamstrings, and calf muscles, play a crucial role in stabilizing and supporting the joint. When movement is limited, these muscles weaken and lose their ability to protect the knee during everyday activities. Weak muscles shift the mechanical load directly onto the joint structures, increasing the stress on cartilage and ligaments. This imbalance not only intensifies pain but also increases the risk of falls and injuries. Psychologically, avoiding movement can create a cycle of fear and inactivity. People who experience knee pain often associate movement with discomfort and thus reduce their activity levels. This fear avoidance behavior leads to further muscle atrophy, joint stiffness, and ultimately a diminished quality of life. Breaking this cycle is critical for managing knee pain effectively. Incorporating gentle, regular movement into the morning routine can counteract these negative effects. Activities such as slow leg stretches, knee bends, or even light walking help activate synovial fluid circulation, improve blood flow, and engage muscles in a way that protects the joint. Movement stimulates the body's natural repair mechanisms and maintains joint flexibility, reducing stiffness and pain over time. Even small amounts of activity, when done consistently, can make a significant difference in preserving knee function and comfort.